Well, thank you so much, Chairman Wyden and Ranking Member Crapo, for holding today's hearing on protecting youth mental health. It is essential that we get our children the mental health support and resources that they need. And I'd like to welcome a Granite Stater who is with us today to serve as an expert for today's hearing. Jodie Lubarsky is the Vice President for Clinical Operations, Youth and Family Services at the Seacoast Mental Health Center in Portsmouth, New Hampshire. She has a Master of Arts in Mental Health Counseling and is a licensed clinical mental health counselor. At the Community Mental Health Center, where Ms. Lubarsky works, she oversees the evaluation and treatment services for children, adolescents, and their families. These services include psychotherapy, psychiatry, community-based behavioral supports, targeted case management, substance use disorder treatment, 24/7 crisis intervention, and post-intervention services to schools and communities affected by suicide and loss. To say she is at the front lines of some of the toughest battles our children face would be an understatement. In her role as Vice President and as mental health counselor, Ms. Lubarsky provides support to young people who are experiencing mental health challenges, and she has seen firsthand how the pandemic and a shortage of mental health services has increased the number of patients in her center. In fiscal year 20, the Youth and Family Services team at Seacoast Mental Health Center provided more than 33,000 services. In fiscal year 21 alone, it provided more than 41,000 services to children and families, a 25% increase. The number of patients seen in fiscal year 21 was almost 13% higher than in the previous year. In response to the wave of children and young adults requiring services, Ms. Lubarsky has worked on innovative programs in New Hampshire that have been integrated into places like our schools and our summer camps. Given her extensive experience and expertise, she'll be able to speak today about the challenges facing our children, the critical programs that she's helped to develop, and the persistent barriers that limit access to mental health care. Jodie, thank you for being here and for your work on behalf of New Hampshire's children and families. I look forward to hearing from you today. Thank you, Mr. Chairman.